mental illness on women and girls demands urgent attention. The report highlights how domestic violence, sexual abuse, gender discrimination, and structural inequalities continue to contribute significantly to poor mental health outcomes. Mental well-being cannot be separated from social conditions. If societies fail to address poverty, violence, exclusion, and inequality, the mental health crisis will continue to deepen regardless of how many services are introduced. Yet, despite the scale of the challenge, there is still reason for hope. One of the most positive shifts in recent years has been the growing openness around conversations on mental health. Stigma, while still present, is slowly being challenged. More people are speaking honestly about anxiety, depression, trauma, and emotional well-being. Communities, organizations, and professionals are increasingly recognizing that mental health support must be compassionate, culturally sensitive, and accessible. Innovation also presents opportunities for meaningful change. Virtual therapy, digital well-being platforms, community outreach programs, and integrated models of care can help bridge gaps in support and reach people who may previously have struggled to access services. The future of mental health care must combine clinical expertise with human connection, flexibility, and prevention-focused approaches. This is where organizations like the AM to PM Wellbeing Service have an important role to play. By focusing on early intervention, accessible counseling, holistic support, and community well-being, services rooted in compassion and lived understanding can help address the growing emotional needs within society. Mental health support should not begin only when someone reaches crisis point. It should exist throughout everyday life, embedded within communities and available without shame or unnecessary barriers. The findings from the Lancet are not simply a warning, they are a call to action. The question is no longer whether the global mental health crisis exists. The question is whether governments, institutions, and societies are prepared to respond with the urgency, investment, and humanity required. Millions of people are waiting not only for services, but for understanding, connection, and hope. If the world is serious about building healthier futures, mental well-being must finally become a global priority rather than a neglected afterthought.
Real change starts with people, it starts with us. At the AM to PM Wellbeing Service, we're building a platform for grassroots action. When you like, share, and subscribe, you amplify our mission and help us empower communities to build a better future. This is how change happens.